I think QI methodology is really a technique that can be applied to a whole range of things. In this case, we're focusing on cancer screening and primary care, but it's really like getting your driver's license, learning to drive. You can then drive in all sorts of different situations. In this case, cancer is what we're focusing on, but it's really teaching you some fundamental steps about analysing the problem, determining what you would like to change, and then working out what you're going to do to create that change. And that really just flows through each of the sort of processes that you're going to undertake to try and improve your cancer screening across the 3 cancers we're focusing on in this particular project. I think when you start out thinking about the challenges when you're involved in a quality improvement project like this, I think at times the concern is about time, people's time, having the opportunity, having the skills and knowledge to do this, and yet you're working with a group of other practices and with a wider group than that, there are other people who've been engaged in this process in other parts of the country, in other countries, and you can learn from things they've already done, find things that might apply to your practice. You don't have to be reinventing the wheel every day as part of that process. It is critical that you do dedicate personnel, people and time to be able to make this process work. Otherwise you're going to find it a frustrating disaster. And so being able to identify and protect that time and those people to assist that process is critical. As a GP, I think one of the critical ingredients is that it doesn't unnecessarily burden me as a GP in terms of data gathering or other processes. Really what we're wanting to do is to improve a process so we all achieve a commonly determined goal. So the learning workshops are an opportunity to meet with other people going through the same process, and that shared experience is incredibly valuable. You get to realise, you hear stories, realise that other people are doing things that perhaps you could implement in your practice. You get to recognise which people are doing some things well that you might be able to work with or borrow some of their ideas to incorporate in your own practice. And you also learn other tips and tricks that may be helpful in terms of determining how well you're going, whether your goals are realistic, whether your utilisation of your resources is actually being as effective as you'd like it to be.